Okay, so the last part of the lecture, thank you for reminding me because I forgot we had problems. Let me just talk about, um, okay, it's going to look a little strange, I apologize. When I left off, the tubes that leave the kidneys are the ureters. And what you're not seeing in this picture, the kidneys would be up here. So you have a right and left ureter. And they enter the bladder at something called the trigone. So the bladder, which is like a balloon, at the neck of the bladder, that's where you find the trigone. Think about it, almost kind of makes like a triangle in a way. And there's two openings to the ureters. And then this is where the urine enters the bladder. So when the bladder is empty, it constricts down, like kind of shrivels up. And then when urine starts, and urine, I should say, urine is made continuously. So as soon as the bladder is empty, urine is going to continuously flow into the bladder, and it's going to start to stretch and stretch and stretch. And this is where it enters at the trigone. And then right after this is the urethra. And the urethra is the tube that leaves the bladder to take urine outside the animal. Okay. Now, sorry. Hey, Bo, stop. Okay, so they're a continuation of the renal pelvis. They go into the ureters and they leave the hilus. They do have three layers. You have the outer is very fibrous. There is a muscular layer, and they propel urine via peristalsis. So there is a wave-like motion to the ureters, and then the inside is an epithelial layer that can stretch because the animal will have varying volumes of urine depending on how much they're drinking, how much they're urinating. So those ureters can stretch to accommodate more or less urine. And then, like most tubes I've talked about in the body, the inner layers, the the epithelial layer, you have a muscular layer, and then you have the fibrous layer. When we do dissection, these are very, very thin tubes. So when you look in, you'll see these two thin tubes that leave the kidney. And then if you find the kidney, you can trace it to the bladder, or some people find the bladder and trace backwards to the kidney. Either way, they are connected. Now, they come in the bladder at an angle. And if you look, this redness here is like a thickened, that's the bladder lining. This is the lumen. And they come in. When the bladder gets full, okay, when it starts to stretch, that will close off the ureters. So for a moment, there is a blockage of more urine entering the bladder until the bladder is empty. And once it's empty again, it's going to allow the rest of that urine to come in. So there is a period of time where the ureters are actually kind of blocked off. Now, all the urine does, it's a muscular sac, stores urine until it's ready to be released. It does have a neck here at the trigone and then enters the urethra. The inside lining of the bladder is actually what's called a transitional epithelium. If you remember when we talked about linings, tissue, I talked about transitional cell carcinoma. So transitional cells are the lining, and what that does is it allows the bladder to stretch without coming apart. We don't want those cells to pull apart. It has to maintain integrity of the bladder. So we do not want this pulling apart. And the transitional cells are the types of cells that are present in the bladder. Now, the muscular part of the bladder is called the detursor muscle. So what's going to happen is the detursor muscle is what's going to start to contract when the bladder gets full, and then there's a signal sent to constrict the bladder, which is when the animal feels the urge to urinate. Now, remember, filling of the bladder and the detursor muscle contracting is all under autonomic control. The outer sphincter, which controls the neck of the bladder, that is what the animal has control over. So this is why hopefully, they can hold it. They can, AJ goes and rings the bell, waits for me to get there. And then when they go outside, they can relax that sphincter. So the sphincter muscle is under voluntary control for a certain amount of time. And then obviously the bladder could win, but hopefully, if you have a trained animal, they can hold it and they can wait till it's time to go outside. So all the urinary bladder does is it collects urine, which is continually made by the kidneys. It will store it, and then once it's full, it's going to release that. Now, the act of urination is called micturition, sometimes called uresis, but to micturate or micturition is the act of urinating. Now, what happens is urine accumulates, and then once it's full, now if you remember, I've talked about with other organs, stretch receptors. There are receptors on the surface of the bladder, and as it gets to a certain size, they send a signal, and then the brain is going to send a signal back to the detursor muscle, and then it will start to constrict, and then the sphincter muscle will hold it till it's an appropriate time to urinate. So there's a process to this. Now, I told you, this is kind of explaining what I just said. Bladder accumulates urine, and then the stretch receptor detects the size of the bladder, and then when it reaches a certain point, the muscle contraction is initiated. Now, there is a spinal reflex responsible for this. When the motor impulse, remember, it's sensory first, motor sends a signal, detursor muscle contracts, and then the bladder will be emptied. Hopefully they can control the sphincter till it's time. Now, I will tell you, in certain times, like we see a fair amount of dachshunds, for example, that have like a ruptured disc. So they have a blown disc because of their long backs. And sometimes, depending on where the injury of the disc is along the spinal cord, sometimes these dogs will come in with a really, really full bladder. And somewhere, either sensory or motor, they are not able to constrict their bladder. So what happens is their bladders get really big. And sometimes we have to do what's called manual expression. We actually have to compress their bladder and release, their bladder for them. Sometimes we can pass a urinary catheter and empty their bladder. Now, sometimes after surgery, well, the goal is, hopefully with surgery, we take out the disc material and the nerve injury gets better and they can start to urinate on their own. But anytime there is a back injury, either due to trauma or from like a ruptured disc, making sure we check the bladder is very, very important, because if anywhere along that spinal cord or those nerves there's an injury, this signal and again, the stretch receptors have to send a signal to the brain. There can be an injury that prevents the signal from going to the brain, or the injury can prevent the motor signal from making it from the brain to the bladder. So again, anytime there's a back injury, we monitor bladder size, because it could be that signal, a lot of times these dogs come in with very, very, very large bladders, and they're not trying to do anything about it. And we have to help them because we don't want a bladder to rupture. Now, again, the control of urination is the sphincter, which controls the opening to the urethra. And it's under voluntary control. And again, as the bladder gets full and full and full, there is more pressure. Eventually, like if you did not make it home for several hours, sometimes your animals may have an accident. Or, in people, you start like, I gotta go. You feel the urge. And initially it might be minor, but if you can't get to a bathroom, it's going to increase in urgency. So, eventually the problem that happens is the fuller the bladder, the more the signal is going to be sent to empty it, which puts increased pressure on the urinary sphincter. And again, it's going to hold, and then there's going to be a point where, hey, we're just going to have to go, and the sphincter releases, and then that's all we got. So it can happen. We got to kind of get there. Now let's talk about the urethra, which is the tube that carries, excuse me, sorry about that. So this takes, if we look in this picture, the urethra goes from the bladder and it extends to either the penis or the vulva. So the urethra is the tube that takes the urine from the bladder to the outside. This bottom picture obviously is a male. And what's hard to see in this picture, and I may have to just send pictures to your Moodle page because right now I'm having a hard time opening things. What you can't see in this picture is the pelvis would be right about here. And the urethra, when it leaves the bladder, it goes over the top of the pelvis and comes underneath, and it wraps around and exits through the penis. Now, up here is the female. The female is a little bit different. There's a very short exit. The bladder connects to the urethra, and the urethra connects through, to the vulva. Now, this is pointing to the uterus and the vagina, which is a separate structure, but I'm going to explain that. This is key to know for the test, is what are the difference in a male urethra and a female urethra. Now, this is pertaining to the dog. The cat is a little bit different, and I'll explain that. But in the dog, and that's what I'll ask about on the test, the female is short, urethra is short and straight. If you look at this picture, it's pretty much like, it's a very short distance from the urethra to the vulva, and it's pretty much a straight shot out. If you look at the male, the urethra is much longer and it curves. I'll give you kind of a real world example. Sometimes you have to place a urinary catheter to maybe get a urinary sample or empty the bladder. Very, very simple to catheterize a male, because when you extrude the penis, you see the opening and that passes into the urethra. The only difficult part is when you start passing the catheter, sometimes it gets stuck around this bend, like it's passing really good, and then all of a sudden you'll kind of hit a little bump. Sometimes we have to back it up and come around. The problem in the female, when we do urinary catheters, even though it's short, the opening to the urethra is kind of deeper in this, what we call like the vestibule. And the problem is a lot of people will pass the urinary catheter and it'll slip up into the vagina, and then it won't go anywhere. There's a very small opening here that's a little bit hard to find, and you have to slip over. There's like a papilla here, a little opening. The urinary catheter should slip into the urethra. But a lot of times if you're passing a urinary catheter in a female and you're only getting in about maybe 2-3 inches, a lot of times it's because you're hitting the vaginal wall and you're not in and it's also blind. It's like kind of you have to go by feel, because you can put a speculum in to try and open it, but the opening to the urethra is a little bit deeper. So it's hard to see it. You almost have to, we put on gloves and we have to try to reach in and feel the papilla and slide it under our finger. And so it's much, even though this looks really short and simple, it's actually much, much more difficult to catheterize a female dog versus a male dog. So there are some differences. So to explain on a test, the first distance, or the first difference is how long. A female is short and straight, a male is long and curved. And this one opens on the vestibule of the vulva. And again, it's a little bit deeper in that vestibule. You can't really see it. The male urethra runs along the penis. So if we extrude a male dog and kind of push out the penis, we see the opening. You can pass the urinary catheter pretty easy. It's very easy to see the opening. Now, there is transitional epithelia inside each of these urethras, which allow them to expand and contract. So again, if they have a lot of urine, a little bit of urine, they can accommodate that flow because they can stretch. The other difference is the function. A female urethra only carries urine. It is strictly urinary function only. In the male urethra, it has urinary and reproductive function. It can carry urine. During breeding, it carries semen. Let me go back to the picture. Now, we do reproductive anatomy in not this coming up week, but the week after. So I'll get into this a little bit more. But when the male testicles are out here, sperm will come up and there's a tube called the vas deferens and it will join the urethra. So when a male ejaculates during breeding, the sperm enter the urethra and temporarily the neck of the bladder is closed off. So when a male is breeding, the only thing that should come out of the penis is semen. It should block off urinary function, but it's the same tube. And one of the reasons this is important, if you go to get a urinary sample on a male dog and they are intact, sometimes you will find sperm. Now that does not mean that, you know, maybe they ejaculated during getting, because again, you should only get semen during breeding or ejaculation, and you only get urine when they're urinating. But because they share the same tubing, it is not uncommon to find a few sperm sometimes when looking at a urine sample if they're not neutered. So because they share the same tube. So you do need to know the two differences in a male and a female urethra. One is their length and shape, which is short and straight. Male is long and curved. And then function is that a female urethra only carries urine. If I go back to this picture, sorry, I keep going back and forth. It's not in this picture, but the uterus would be here and the ovaries. The reproductive tract, even though they share this opening right here, it's a separate tract. It's not part of the urethra. Like I said, the uterus opens to the vulva and the urethra opens to the vulva, but they separate and are two separate tracts, okay? So those are the two differences and how I would want you to explain it to me on a test. Okay, so if there's no questions about that, let me get into going over the study guide, and I can then go back to, yeah, and pretty much, and hopefully you've realized when you are going over, a lot of times my study guides go right through the notes. So it says identify the structures of the urinary system, which are pretty much the bladder, the ureter, the urethra, and the kidneys. So from a structure standpoint, you know, starts in the kidney, comes down the ureters, which enter the bladder, which exits via the urethra, and the urethra would connect to either the penis or the vulva, which are part of the reproductive system, but that's where the urethra, and again, people get urethra and ureters confused. Ureters come from the kidneys, and there are two, but there is only one urethra, which is the tube that leaves the bladder. It says, identify functions of the kidney, which if we go back to, okay. Here, which is slide number 6. So slide number 6, waste elimination, that's its number one job. Maintenance of homeostasis through blood filtration, reabsorption and secretion, fluid balance through regulation of ADH. We've got acid-base regulation, production of hormones, and blood pressure regulation. So, you know, I always like to say, what does this organ do? These are all of the jobs of the kidney. Where are they located anatomically? So to describe where they are not just in the abdomen, okay? So they are ventral to the first couple lumbar vertebrae, L1, L2. They're right underneath. They're retroperitoneal, so they're up under the peritoneum. They do have a layer of that fat, and there is a capsule that encloses each kidney. And they are also just caudal to the last rib. So behind, now sometimes people on a test say the kidneys are caudal to the last rib. Anything in the abdomen is caudal to the last rib. That's not specific. The whole abdomen is caudal to the last rib. But if you put caudal to the last rib and ventral to the first couple lumbar vertebrae, that makes sense. Identify a cortex, medulla, and the hilus, which basically there's not going to be just a picture of the kidney itself. But you know, the cortex is this outer core, the medulla is the middle, and this is where the nephron is located, half in the cortex, half in the medulla. And the medulla then connects to the calyces, which empty into the renal pelvis, and that's what collects the urine and connects to the ureter. What is a nephron and what is it comprised of? Oh, and remember, this was also significant. The cow has this unique, what's called lobulated kidney. It looks like little lobes or bumps. Again, if this was a cat, this would be extremely abnormal, but it is very normal for a cow. Other than that, it should be smooth. Hopefully, I don't know if everybody's on the Facebook page, but I did post, I was in another group and someone posted a picture of two, like a normal kidney and an abnormal kidney from a cat. And I put it on your Facebook page so you can see kind of a picture of a kidney that's been taken out. Sometimes during dissection, it's interesting. We had a cat that had one really big kidney and one tiny shriveled kidney. So that cat was probably had some kidney disease for sure. So we might find some interesting kidneys on dissection. So the nephron is basically what you need to know is we have, first of all, the blood flow comes in now this whole thing is called the renal corpuscle. The renal corpuscle is the glomerulus, which is the filter, and then you have what's called the capsular space, which is the space around the glomerulus, and then you have the Bowman's capsule. And then that's where the filtrate is made. That's where blood is filtered. And then after that, it's going to enter the PCT, continue to the loop of Henle to the DCT, which then connects to the collecting duct. Now, and if you see on this picture, half of this is in the cortex, half of this is in the medulla. But if you look, that collecting duct dips into the medulla, and that's then where all the nephrons, and remember, a cat can have like 200,000 nephrons. So 200,000 of those collecting ducts are emptying into the calyces to the renal pelvis, and then all that urine that all those nephrons made enter the ureter and go to the bladder. So that's the process of blood being filtered. Now, the other structures in this picture is you have what's called the peritubular capillaries, which are these red and blue tubes, and that's the site of oxygen exchange and CO2 to the nephron, but that's also the site of reabsorption and secretion. Now, when I say secretion, I am talking about urine production. So if something is secreted in the kidney, it means that it left the blood, it entered these tubules, and has become urine. So typically we're talking about wastes. Now, when I talk about reabsorption, that's things the body wants back. Remember, when the kidney filters blood, it is not specific. Everything that's soluble gets pushed out, good or bad. And then the body can decide to reclaim that via the peritubular capillaries. So it can get reabsorbed back into the blood. So I'm going to come back to that. So the function of each, which The renal corpuscle, which is like in this whole string, this is the first stage of urine production because this is where the blood enters and then it's pushed through now the glomerulus is the actual filter. So this is where the blood is filtered. If something is soluble, it's, glucose, potassium, calcium, body water, urea, nitrogen, it's going to get pushed out into that glomerulus and then it's going to enter the capsular space. So what's inside the capsular space? That's called glomerular filtrate. Glomerular filtrate is going to become urine. When it's in, right after it gets pushed out of the glomerulus into that space, it has become glomerular filtrate. Again, my analogy is this is a strainer. If I take a can of tomatoes and dump it in the strainer, the juice under the bowl is tomato filtrate, okay? Not everything fits through the strainer. Red blood cells, white blood cells, platelets, protein, that stays in the strainer. In this example, that stays in the bloodstream, okay? So not everything is going to get filtered out, but if it's small enough, meaning soluble, that it can fit through those fenestrations of those capillaries, it gets pushed out and it becomes glomerular filtrate. Now the PCT has reabsorption and secretion function. At this stage, once the filtrate moves into the PCT, it becomes tubular filtrate. And that's like the next stage. It's going to start to travel through. The loop of Henle, or the DCT, is an extension of the loop of Henle, where we have reabsorption and secretion. And then the DCT is an extension of the loop of Henle, and that's where we primarily have a lot of reabsorption occurs there. Because if the body needs to reabsorb body water, sodium, potassium, remember I said the DCT is the last stop before the collecting duct. So it's almost like an alarm. It's kind of like the train. Last stop, this is your last chance to get off the train. If the body wants to reabsorb something, after the DCT, it moves to the collecting duct, it is urine. So that's the body's last chance. So this is primarily where you have your ADH if it wants to reclaim body water, any sodium, if it, and it can secrete as well. What is the primary blood, and pop in or unmute yourself if you have a question, please. What is the primary blood supply to the kidney? What is the afferent, efferent arterioles? What are the peritubular capillaries? Well, let's review the blood flow. Actually, let me go, there's slides that are specific. Okay, everything I explained, I've explained all these slides. So this is where it talks about the DCT, which is slide 15. Okay, so when blood comes in, remember we go big to small. Blood comes into the kidney via the renal artery, which is a branch of the descending aorta. And remember, this is like a road. If I get off 465 and I get off at the primary, like 116th Street, the renal artery, and then the renal artery is going to branch to every single nephron. So if there are 200,000 nephrons, I have 200,000 renal arterioles, right? They're going to branch. And when a renal arteriole branches, okay, it's going to go via an afferent arteriole. Afferent, so do you see how the afferent arteriole comes into the glomerulus? Blood is filtered. Now, I told you not everything gets pushed out of the blood. If it stays in the blood, some body water stays, red blood cells, white blood cells, platelets, protein, that all goes and leaves the glomerulus via the efferent arteriole. Now, efferent is going away. That is what's going to become, so the glomerular capillaries are going to filter out some blood. Then it comes out the efferent arteriole, and that becomes the peritubular capillaries. The peritubular capillaries have a couple jobs. Number one, a peritubular capillary gives the gives oxygen to the nephron, right? And then it picks up CO2 to go back to the lungs to be excreted. The other thing the peritubular capillaries do is they are going to reabsorb things that the body wants. If for some reason, remember I said like sodium, potassium, glucose, some, they got pushed out and the body's like, give it back. The peritubular capillaries are going to reabsorb those compounds back into the bloodstream so the body can use them. And that happens at the peritubular capillaries. And then also, say some things didn't get filtered out that the body wanted, the peritubular capillaries can give material from the capillary to the tubules. So reabsorption and secretion can still happen at the peritubular capillaries. But and if you remember, this is our blood flow. Renal artery, renal arterial, renal capillary, O2 for CO2, renal venule, renal vein, vena cava. So you go, remember, big to little, little to big. Okay, and that's kind of that transition of blood flow. It says, where is urine made or excreted? Urine is made in the kidneys and it excreted by the bladder. It's a very simple question, simple answer. I just get some people that say the bladder makes urine. It just stores it and releases it. That's all its job is. It's got the easy job. The kidneys are what is filtering and excreting and making, and then you remember, urine is made continuously. It's being sent to the bladder continuously. There's a lot of things that factor in how fast urine's made. I mean, if you drink a gallon of water before bed, there's a good chance you're going to wake up in the middle of the night to go to the bathroom. Some people will pull up, if you've got a dog that guzzles a bunch of water, some people pull up water at night so that their dog doesn't drink as much water and wake them up. No, I had a boxer wake me up at 4:30 this morning. I was not very happy, but maybe I need to start pulling up the water. But you can, access to water will influence that some, but there's all the homeostasis involved too. Be able to explain what the GFR is and where primary absorption occurs and where primary secretion. So I kind of explained this, but blood goes to the kidneys, blood is filtered, things that are useful are reabsorbed, things that are wastes are secreted. But let me talk about the filtration. You remember GFR stands for glomerular filtration rate. What is the rate of production of filtrate? Now, arterial blood is under pressure, blood pressure, okay? Normal blood pressure, blood is going to come in and naturally, because that filter, the glomerulus, is under pressure, things get pushed out. Now, how the glomerular filtration rate depends on the blood flow to the kidney. Remember, I talked about my strainer. I said if I just pour the tomatoes in the strainer, juice is going to come underneath. But what if I start pushing on those tomatoes? What if I put pressure? Then I'm going to increase the amount of tomato juice that comes out underneath. I'm going to increase production. Also, a consequence, I might push through some bits of tomatoes through those little holes because they're under pressure. An animal with high blood pressure could have an increase in their GFR because the blood is coming to the kidney under higher pressure. And on the flip side, if an animal has low blood pressure, they're suffering from low blood pressure, there could be an issue. Remember I said blood flow has to be, or blood pressure has to be at least a mean of 60. If we were measuring it on a monitor, to ensure blood is sent to the kidney. If it starts to drop below 60, the body starts to go heart, brain, lungs. And kind of the kidneys don't get blood flow, which stops filtration of blood and production of urine, which can make your animal very sick. And then your nephrons don't get oxygen, and that causes a problem. Primary absorption occurs at the peritubular capillaries. That's the answer I want. And primary secretion occurs at the DCT, because remember, the DCT is the last stop. So if the body wants to secrete, that's your last chance. Okay, so secretion is urine going out. Last stop is the DCT before the collecting duct. And the primary site of reabsorption is the peritubular capillaries that are surrounding the tubules, and they reabsorb. Now, I didn't ask a question about this, but I want you to know, what are some things that can be reabsorbed? What are useful things? Sodium, potassium, calcium, magnesium, glucose, chloride, bicarb, and water. So these are all things that get pushed out at the glomerulus and become part of the filtrate. But the body usually will want some of them, maybe not all of them, but would want maybe some of that back. So these are things that are useful to the body that they want back. Now, let me skip over to secretion. Things that are secreted, which is really at your DCT because it's going to the collecting duct, these are typically our waste. So hydrogen, potassium, ammonium, and sometimes medications get secreted. Like I explained, ketamine in the cat is pretty much 90% excreted active. So in a cat, they rely on kidney function to wake up from ketamine, to secrete ketamine. The problem is, if they can't secrete it, if there's an issue with the kidneys or blood flow or kidney malfunction, that can alter excretion of ketamine, which may make my anesthetic last longer. And, like I said, if I have a cat with kidney issues, I do not use ketamine as part of the anesthetic protocol. We stay away from it because we know, or I would use a really, really low dose because it may have a more profound effect in my patient. Ketamine, cat, kidney. So that's an example. How is urine volume regulated? How does ADH play a role? So ADH, and we're doing hormones next. We're doing endocrine system next. ADH is a hormone called antidiuretic hormone, and it helps maintain hydration. So now, when I'm talking about hydration balance, I'm not talking about an animal that's like skin is tinted, 10% dehydrated. The body is going to try to fix minute, almost what I call subclinical dehydration. So if an animal isn't drinking much water and maybe they're slightly dehydrated, the body will release ADH from the brain, this antidiuretic hormone. It will go to the kidney and it will say, stop or slow down your water being excreted in the urine. It will retain body water in the bloodstream to hopefully raise hydration levels. So ADH has its effect at the kidney. What is it monitoring? Hydration. So if I have an animal and they're ADH deficient, then what I worry about is that the body can't balance that body water. So what happens is they tend to urinate. The animal tends to have polyuria. And as a consequence of urinating all the time, they tend to drink more. So when we have an animal that's PUPD, a lot of times, like I said, they go together. But what typically happens is the polyuria happens, then the polydipsia. Some other disorders like diabetes, they're typically polydipsic first, and then they become polyuric, So it's kind of like I said, chicken egg thing, what comes first? If fluid is retained and not excreted as urine, how does that affect blood pressure? So what the body can do, you know what? Let me talk about this question because I don't think I talked about this on Friday now that I'm looking at this. Okay, if the body is having low blood pressure for a variety of reasons, the kidneys will initiate this thing called the renin-angiotensin system. Now, angio means vessel, tension, tension or pressure. Angiotensin, that's where that word comes from. Renin splits angiotensin, and what this does is it tells the kidney to, at the kidney level, the bloodstream, reabsorb sodium. So what happens is sodium, instead of leaving in urine, sodium gets reabsorbed in the bloodstream. Now, what did I tell you? Water follows sodium. So if the body retains sodium, it knows water will follow. And then what happens is you have more water back in the vessel. What does that do? Increase pressure in the vessel. If you have more water in a vessel, you have more pressure in the vessel. Therefore, as blood volume increases, hopefully blood pressure increases. So this is one way the body helps maintain adequate blood pressure, is at the level of the kidney. And that's what I was looking for. It's this renin-angiotensin system. I mean, now, this again can be minute levels of blood pressure issue, not like shock level blood pressure. You know, the kidneys will try to do their part. They can't completely save blood pressure all the time, but this is one system that can be initiated. Okay. Hopefully on questions 12, 13, 14, 15, that's what I just lectured on. So hopefully on 13, the muscle that causes contraction to expel urine, that's the detursor muscle. The sphincter muscle is what controls the opening. The detursor muscle is what contracts the bladder. The ureters come from the kidney and they enter the bladder at the trigone. And then the lining of the bladder. And what's interesting is when I was talking to you guys about my cat, when I did my cat's UA a couple weeks back, and I did a cystocentesis sample where you put the needle directly in the bladder. I didn't squeeze his bladder to expel urine. I didn't collect it off the floor or a litter box. And when we looked at it, I saw some red blood cells, some white blood cells, and I saw a lot of transitional cells, which concerned me because those are lining cells. And I, of course, my brain goes TCC. But he had an ultrasound of his bladder, and it was normal. He has some potential UTI. So sometimes when the bladder is inflamed or irritated via infection, sometimes they will shed these cells, because when the bladder becomes inflamed, it can cause you to see sometimes more of these cells. On a side note too, my cat's blood work came back. He is anemic, which he is regenerating. So I got a report that he has reticulocytes, and he has definitely some positive, what we call regeneration signs. So we have him on a steroid. Hopefully, if we can chill out his immune system from attacking his red blood cells, and so we can see an improvement there. This was not a question on the study guide, but if you remember, two things that I talked about, BUN. So BUN stands for blood urea nitrogen, and it's a blood test. It's one of the primary markers of kidney function. So if we want to know how an animal's kidneys are, is we will typically draw a BUN. Now, there is appropriate levels of urea nitrogen in the blood. Normal levels are like 5 to 25-ish, depending on the lab you use. When an animal has elevations in BUN, then we worry that the kidney isn't excreting urea or nitrogen, and it's being allowed to build up in the blood. And why, animals that are in renal failure, when we get very, very high levels of urea and nitrogen, it makes them feel very ill. That's why they feel nauseous, tend to not eat. One thing that I want to talk about going back to the nephron is when a kidney does not get oxygen, say for example when blood pressure falls and we don't get good blood flow to the kidney and it doesn't get oxygen, those nephrons can die. It takes about almost 50% loss of nephrons before you will see an elevated BUN. So you can see how critical it is to maintain good blood pressure. I mean, that's why I worry about blood pressure during anesthesia, is that, you know, we're trying to maintain that good blood flow to the kidney, to continue to make urine, to excrete waste, but to continue to get oxygen to the kidney and therefore keep those nephrons alive, because the nephrons do not regenerate. Once a nephron dies, that's gone. And so, you know, that's kind of the consequence of not keeping up good blood flow to the kidney and keeping a good, healthy kidney perfused. So let me go back to, sorry, this is like moving really slow. Go back to this picture of the, so this is the picture that will be on the test, this picture of the nephron. And again, you know, when we look at pictures, you've seen my pictures on tests. I either like to point to something and say, what is it? Or where does this happen? The big thing is to remember is you have, this is a branch of the renal artery. It's an afferent arterial coming into the glomerulus. It's an efferent arterial leaving. And then the efferent arterial branches and becomes the peritubular capillaries. After oxygen is exchanged and CO2 is returned to the blood, then those capillaries join the renal venule, which is going to go to the renal vein, which is going to go to the vena cava. That's the blood component. Now, when this glomerulus is what filters blood in the first stage of urine production, which becomes glomerular filtrate, moves into this PCT to become tubular filtrate. Now remember, this tubular filtrate has useful substances and wastes. So as it travels through the PCT, the loop of Henle, and the DCT, at the level of the peritubular capillaries, the body can reabsorb that, you know, sodium, potassium, the glucose, some body water, or it can, you know, if it stays in there, once it leaves the DCT, it enters this collecting duct, and then that becomes urine, and then it is gone. Are there any questions about this picture? Any questions for the study guide? I will send an email, but again, the test will be, and again, this one, just because my computer is just not liking me lately this past week. My husband's going to hopefully fix it tonight. This test will be on Moodle. I'm sorry, Teacheries. 1 o'clock. It will open and close at 6. You'll have 75 minutes. And then Wednesday we will start, I will be posting new material and we will move on to the endocrine system. And what I will do is I will convert this recording. I will post it to Moodle. I posted Friday's lecture this morning. So you'll have all the lectures on Moodle. I just went over the study guide. You have the pictures. I have a picture. I'm going to try to take a picture of it and load it to your page, because I drew like blood flow and I talked about what happens, and I thought this might be useful. Sometimes I like to make diagrams like this. So I'm going to try to take it as a picture, or I might post it to your Facebook page. Any questions? Everyone's been real quiet.